I'm gonna assess for any swelling. So first I'm just gonna kind of go like this. Okay, there's no swelling after assessing for that, and I'm gonna check her capillary refill. First I'm gonna do so on her toes. Less than 3 seconds. Less than 3 seconds. Fingers. Less than 3 seconds. And less than 3 seconds. I would also be looking at the IV site and look at the flow rate, make sure everything's like properly installed, and if there's no issues with that, and she does not have an IV, so we are not going to be assessing that today. And now I'm going to check her pulses. First, I'm going to do the pedis pulse. That is 2+. Next, we're going to do her tibial. Also 2+. And lastly, I'm going to do, can you hold your arms out for me? I'm going to do her radial pulse. That is also 2+. Next, we are going to assess skin. Her skin still appears, oh, if there was anything with DVT, any prevention devices, I would make sure that those are properly installed, working properly. Now we're going to assess skin. Her skin is still tan and pink. I'm not noticing any cyanosis or anything like that. She has no lesions, nothing like that. If she did have a lesion or an ulcer or something, we would perform the Braden scale to assess for breakdown. Her skin feels warm, no coolness or anything. If she was, like if she had a pressure injury or something like that, we would maybe possibly be looking at implementing like a turning schedule, but we do not have to do that today. And if there's any like breakdown devices that help with pressure injuries, we would also be making sure that's installed properly. And next we're going to move into abdominal. So can I have you move your shirt up for me? Are you having any pain in your stomach?
Just like right up here.
Okay.
Where it was.
I'll make sure to be cautious of that. And I'm going to start in the right lower quadrant and move clockwise. Okay. Is it okay if I move this down a little bit?
Mm-hmm.
Okay. There we go. Bowel sounds are present in all 4 quadrants. And next we're going to palpate for any tenderness or masses or anything. I'm going to be cautious because she's having stomach pain. And you just tell me if there's any tenderness or if anything's hurting, okay?
Okay. This is a little sore up there.
Okay, I'll be extra cautious then. Okay, and I did not notice any masses or tenderness or anything. Kylie, do you have any nausea or vomiting right now?
No.
Okay, and then next we're gonna move into bowels. How often do you have a bowel sound?
Probably once a day.
Okay, or bowel movement, not sound. Can you tell me what your last stool looked like?
Type 4.
Okay, that is normal, that is good. What is your diet look like? Is it normal? Do you need any changes?
It's good right now.
Okay, that's good. How often are you urinating?
I would say, a few times a day.
Okay, and can you describe like the color and stuff?
Clear, light yellow.
Okay, that's normal, that's good. How much are you urinating?
Probably around a cup each time.
Okay. And then next we're gonna move into movement. Do you have any issues with walking or anything?
No.
Okay. Do you use any assistive devices?
No.
Okay. If we we're assessing mobility and we suspected that there was some issues, we would be using a scale like the Morse scale, but we will not be doing that today. And lastly, I would ensure that the bed is lowered all the way, which we cannot do on this bed, and that everything's locked, that the lower side rails are down. And Kylie, do you need anything else while I'm in here today?
I don't think so.
Okay, thank you for being in my patient reassessment video. And then before leaving, I would ensure that I performed hand hygiene